approval of the September 28th, 2022 meeting minutes. Do I have a motion?
So moved.
I think Ken was first and Norman was second. Thank you. Any discussion? Any edits, any changes? Hearing none. All those in favor, say aye.
Aye.
All right, it's unanimous. We got 3 ayes. Thank you. Motion passes. The next item on the agenda is the director's report. So I have a few quick updates. Wanted to provide you an update with the water emergency with the drought situation. So we continue to monitor the situation, and we meet weekly with the water utilities. Us and several other representatives from different city departments, mayor's office, DPW, and we get updates. And so just wanted to let everyone know we've been following the recent rainfall, and sort of where we're at now is the levels have become more stable. The conservation efforts that people have been making, the recent rain, have definitely been helpful. It's saved and helped the reservoirs from further depleting. But some people have been asking, when can the water emergency be lifted? What does the drought situation look like? And so we don't have a time frame right now. We're just continuing to closely monitor it, and we'll continue to meet with them weekly and adjust accordingly. But right now, we're sort of, in the place where it's important to still conserve, and we're hoping to continue to hope for more rain, because we're continuing to be, below the levels that we normally are. And we're just making up for a lot of the deficit that we experienced over the summer. So I wanted to provide that update with you all. We continue to work on the updating strategic plan. I really want to thank all the work groups, all the facilitators, all the staff for putting this together. Megan, Aniela, and I met for a couple hours yesterday going through the draft work plan. And so we're making some edits and changes, and we're going to go back to the staff with some more questions. And the hopes is to be able to bring the product to you all either next month or the month after, but we're getting really close. And so I just wanted to give you guys all that progress, that update. And thank you again to the staff for all that they're doing with their strategic plan. We wanted to share a staff update. Aniela has been promoted to project coordinator. So she's now our official accreditation coordinator, and she's going to be managing department-wide projects and working on quality improvement, workforce development, performance management. And, Aniela joined us a little over a year ago, and she's just been an amazing addition to the team. And so really happy to have her in this role and being able to continue to grow as a public health professional and an amazing member of our team. So congrats, Aniela. Really happy that we have you on our team.
Congratulations.
Thank you, everyone. I'm very, very thrilled.
Excellent. Good job.
And so with Aniela being the project coordinator, we have now a vacant position for a public health program associate. So that recently was sent around to the union for a bid. So we'll see if we have any applicants, and we'll move forward with filling that position. But we are moving forward, seeking approval from the Common Council to be able to utilize a new software system together with, under the community services umbrella with the Human Services Department. Viochi, it's a software that can be utilized for emergency preparedness purposes, emergency response purposes. We're looking to utilize a system for inventory management, volunteer management. We can log, calls in to be able to triage situations. The state health department's actually using the system right now, and there's several other cities that use it, like New Haven and Stanford. And so looking forward to continuing to advance that process forward. And it's really exciting, working with a system that can support different departments, within the community services department. And you all remember that technology, it was a big theme coming out of the efficiency study from the city. And it's something that we've been talking about for years and years, as the board too, about the need for investing in technology. And so that goes to the Common Council tonight, I believe, for the final vote to authorize being able to utilize that software system.
Will
So
that
the
be, would that integrate with the larger systems, the Yales and all the rest of the stuff you mentioned? They're on the same system, but do they actually integrate that if, data is entered at a local level, it populates up the stratosphere? I was actually interviewed by HRSA yesterday, and our project officer has us working on a program also. And I'm trying to make sure that those kind of levels are talking so that people aren't duplicating efforts over and over again and having different responses.
So I can answer that question like for a local perspective, and I'll pass on to Brian to see if he has any additional comments to make. I'm not sure about the connection between the different like electronic health record systems, but it will be able to communicate to the different city systems. Our IT department, Joyce, IT director, has been really involved in this and making sure that we'll be able to extract the data and be able to utilize it in different systems to be able to, communicate the information and share it out. Brian, do you have anything you want to add to that?
Yeah, so currently with the current process, it's a pilot project to, utilize it in this fashion for community services, human services, the health department, but then it also has potential to expand to the city in general for other city departments to utilize as well and kind of consolidate and make more efficient and effective, city services as well for other utility, or uses like, public works can also use it, again, the emergency operations center can use it, things like that. So it's we're kind of a pilot project here just to evaluate it and see if it has that broader use, along with obviously the IT director being a part of that and kind of seeing how that plays out as well too.
Well, I'll push it down the HRSA pathway, because if we find a way to be able to roll all that stuff up, the reporting that they want to be able to do at the federal level is they want to be able to do instantaneous reporting idealistically. But even if it followed all the way, it's up the tree a couple of ladders. I think that would be smart. So I'll check in with the HRSA people that I know.
That would be great, Ken. I'd really appreciate that. And then we can also follow up with the state health department, seeing as they are utilizing the system as well.
Right,
so
right.
Yeah. Thanks, Ken. That would be great. And then just the last thing I wanted to share with everyone was the state health department provided feedback. Annually, we're required to submit a report to the state health department, and they ask a series of questions about, how we deliver the 10 essential public health services. And they also ask to see a sample of some of our documents that demonstrate how we do provide those services. And they recently did an assessment of the documents we provided, and they found that everything that we submitted to them met the requirements. And so they're going through all those documents. And then they also identified 2 of our examples as model practices for other health departments. So that was really great to see. And again, want to thank the staff for all that they did to put that together. And Yell and Megan took a particular lead in, like compiling the documents and making sure it was easy for the reviewers to see that their requirements were met. And then, of course, we know all these documents have been evolved over time and put together by the staff. So great job, everybody. Great job, team. And I think those are my updates. So unless there are any other questions, I'm going to go on to the next agenda item, which is surveillance updates. So Brian, can I pass it to you?
Yeah, thank you, Deanna. Hi, everybody. Good morning. Let me just jump over to sharing screen and we'll kind of do our usual update here. All right, so what should be popping up on your screens again is the usual City of Norwalk, Connecticut COVID-19 Data Hub update. All right, so as you can see here, starting off with the most important thing that gives us a good idea of where we're at. We have the CDC COVID-19 community levels. Again, keeping in mind that it's a 3-tiered system, low, medium, high, and factors in the case rate for the county, but also just the healthcare system burden for the county. So as we can see right now, we've been holding steady for the last few weeks at the medium level for Fairfield County. And as a reminder, what does that mean? Staying up to date with COVID-19 vaccines, getting tested if one has symptoms, also just not showing up to work or other activities or school if somebody suspects they may be sick, And then also for those at high risk for severe illness, talking with their healthcare provider, what sort of prevention measures they should enact. But then also, if a face mask would be another beneficial item for them. In addition to that, anybody that feels like they want to wear a face mask in indoor public settings, by all means. Again, as this weather gets cooler, it becomes easier to wear these face masks. But then secondly, also it helps to mitigate all the respiratory illnesses that are circulating. And I'll go into a little bit further detail later on. So then moving forward again, there's also resources here, the testing, the vaccination, as well as the Norwalk COVID Info Center, which is, a lot of the guidance materials for individuals and different populations that can kind of reference this information. So don't forget about those links as well. So jumping over to the Big Seven Connecticut cities comparison when it comes to case rates and percent positivity. So this is most recent data from yesterday. If you look at Norwalk over here, again, you can see how we kind of sat around the late 60s. We were actually in the 70s not too long ago. Again, we have to keep in mind the gray area that we do have now with a lot of people doing at-home testing, which is not reported. Again, this information that's accounted for in these calculations is reported COVID testing. So that's usually coming from a healthcare institution. But as you can see, the percent positivity has jumped up over time. And so that's something else to kind of factor in as well. If you look at other localities, you can kind of see they have a similar situation where it's kind of jumping around a little bit, but it has been a steady and general increase for most of the towns and cities in Connecticut as well in terms of COVID. So it's just something to keep an eye on.
Hey, Brian.
Yep.
Has anybody studied what percent that is of home use now?
I haven't seen exact numbers, but I would anticipate it's definitely more than 50%. And I think it's definitely the majority of that. We obviously still have regular testing sites that are for the public that can be utilized by anybody, regardless of their insurance situation, but they're situated in very specific areas. And we have our own at Lockwood Matthews. I just want to hit that point home about that testing site, actually, because that's 3 days a week now, and it does saliva testing, which is even better. And so, but yeah, it varies in terms of the availability of that, healthcare institutions for individuals. But then also a lot of people are just opting for the at-home test. They're readily available at pharmacies and things of that nature. I was wondering if
the percentage would be any different being done at the home tests, or as if it's the same, statistically the same values, then we don't worry about it just being more bigger denominators and numerators.
Yeah, from a local perspective, it would be really interesting to see that information. That is kind of a form of syndromic surveillance, looking at pharmacies. It's not something readily available to the local level, so I can't pull those numbers. But I would anticipate, it's definitely the majority in comparison to the healthcare institutions doing testing. Most people, obviously, that go to those institutions to get tested are typically experiencing more severe symptoms, or they're in the hospital. That's where the testing is occurring. So when you kind of factor that in with the mixture, some people are still interested to get the PCR testing. You have a pretty large ballpark that's mostly at home testing. It's safe to say. I mean, I can't give you an exact number because I don't have a study to reference at the moment, but you could say it's almost 3/4 or more probably. But yeah, excellent question. But it's kind of the reality we're dealing with right now, and especially since it's become readily available, plentiful in terms of accessibility for those tests as well. So, so with that said, again, with the CDC community levels, we got to keep in mind that it's really looking at severity of illness, right, in terms of the healthcare system. So this is a much better metric to look at this. And that's kind of how we're also triaging COVID, just because, the anticipation of, it's very successful transmissibility, as we're well aware. So as you can see here, this data is actually up to October 22nd. The state hasn't updated this data yet. I just double checked it again. But nonetheless, where it is for October 22nd, we're at 402 COVID-associated hospitalizations. And when you look at it from a county perspective, you can see it's kind of, obviously Hartford County is the highest at 137, New Haven County at 117, Fairfield County at 88. But nonetheless, as you can just see over time, generally speaking for the state, it's a gradual increase. And it's something we've been anticipating. It's going to keep growing as we get further in the fall and into the wintertime. So it's just something to keep a close eye on, because again, this is indicative of severity illness. It's one of the indicators. So it's a really important measure just to kind of keep an eye on. But, in terms of vaccination, initiated vaccinations at 89.35%, fully vaccinated, 80.61%. Additional doses received, about 44.22% for the city. And if we look at wastewater monitoring, which is another important indicator, kind of what's really going on, given the gaps that we just talked about with at-home testing, you can see how, just recently it's a little bit of a dip, but then overall speaking, in terms of the last few weeks, it's been a general increase as well, which is what we've been anticipating. This is indicative of Fairfield County. Majority still BA5 based upon, the surveillance that they're doing here relative to the wastewater monitoring. But nonetheless, as we can see, here, let's look at this first. This is the CDC community levels. I just want to look at it from a national perspective as well, because it kind of just shows the patterns of what we anticipate, who's going to get hit hardest soonest. And as you can see here, again, green is the low, then you have the medium and high, which is yellow and orange respectively. And you can see the largest proportion of that yellow and orange is the Northeast. So we're obviously the ones that get hit the quickest here as we enter the fall winter season is what we anticipated. So it's pretty obvious here. You can see a good portion of New York and especially upstate New York that's really experiencing that high categorization. But then even you got New Hampshire and Maine also kind of getting impacted as well. And so it's just, really important to keep in mind that most of Connecticut's obviously in the medium and even Massachusetts, and then obviously New Jersey. So we got, a great amount of activity here in terms of, COVID relative to the CDC community level. So it's just something else that, we all going to be ready for as this kind of keeps increasing over time. So with that, with the COVID variants, this has obviously been in the news a lot. If you haven't heard, we got a lot of new variants and subvariants of Omicron that have been detected that are starting to gain in proportion and obviously traction in the nation. So as you can see, the greens are kind of the ones to keep an eye on. So it's kind of like like a pine tree green, and then you have this darker green here. But you can see over time, especially the most recent weeks, relative to the nowcast model from the CDC, how it's really gained in proportion quite a bit. We've been dealing with our usual friend here, BA5, which is now only about 62.2% of national specimens. BA 4.6, which we were familiar with, is at 11.3%, which was slowly growing in proportion. That's the blue here. But as evident, we have BQ1 and BQ11 at 9.4%, 7.2% respectively, kind of really entering the picture. And then even in the lighter shade of green, BF7. And then there's also the XBB you might have been hearing about. That's still fairly rare, but it's also suspected and potentially expected to also grow as well. So it's something else we'll have to keep an eye on. But relative to BQ1 and BQ11 especially, there's been, the preliminary scientific research indicating that's, not only more infectious, but it also has the ability to be evade the vaccine as well as therapeutics even more. So this is kind of what we're familiar with at this point in time. Once the variant or subvariants out of the bottle, so to speak, it slowly grows in proportion unless some other subvariant or variant outcompetes it. So it's pretty evident over time, it has that growth potential. And, as you can see here, regionally speaking, region 2, which is New York, New Jersey, Puerto Rico, and the U.S. Virgin Islands, is the largest proportion in comparison to the other regions, but also just the eastern seaboard. You can see the Midwest, it's really grown in proportion, as well as the West Coast, which was not even the case last week, where it was definitely, region 2, but then maybe a little bit of the South, and it wasn't as noticeable in these areas, but it's obviously grown quite quickly. So it's going to be impacting the country all over. Just these portions of maybe the Midwest here are a little bit better off in terms of it slowly growing as opposed to as quickly as it's doing with the eastern and western seaboards as well as the south. So then with that, we also got flu. And so this map also is changed quite dramatically. So this is monitoring from the CDC in regards to influenza-like illness. So you have to keep in mind some of the gray areas in terms of interpretation, because some symptoms overlap with other respiratory illnesses, but they do their best to obviously exclude for COVID. But nonetheless, as you can see here, we got New York that's in the high. So that's definitely a big change there. You got New Jersey in the moderate activity. We got Connecticut that's kind of in the low, if not bordering on, moderate activity. You got the South with Texas. as well as good portions of the Southeast are in the high category, as well as just, the South, Midwest, even California entering the mix, that are experiencing that uptick in flu activity. So that's really happening. Even Puerto Rico, DC, and then even they have a breakdown for New York City, which is at least in the late moderate, if not high category. So, flu's picking up, and respiratory illness in general. So that kind of hits that point home. Excuse the paywall because I looked at the article too many times on the Hartford Courant. They only let me see it 5 times. But this is a really important article. There's a bunch of other articles that have come out from the Hartford Courant. They've been doing, pretty solid job reporting on this, as well as other news agencies. The big point to hit home here, if you have seen this in the news, Connecticut Children's Hospital in the Hartford area has been, kind of inundated with, respiratory illness in pediatric patients, more specifically for RSV. And that's not limited to just them. Even Yale New Haven Children's Hospital has also been seeing that uptick as well. And so it's very concerning given that this is early in the season. It's coming at quite all a bit at one time. And, there's even, been talks and coordination with FEMA from Hartford in regards to just having extra capacity to be able to address this because, we have COVID entering the mix too, with these new variants and subvariants, as well as, flu also entering the picture as well. So it's going to be, it really demonstrates that this fall winter season, respiratory illness wise, may be not only difficult and complicated because you'll have a lot of different respiratory illnesses appearing, and maybe actually the worst we have of the pandemic. That's one other thing we have to kind of contend with. It's something really important to keep in the back of our minds. So, prevention measures are an important part of this. Staying up to date with vaccinations really emphasized as well. So I do want to hit that point home. And part of the reason for RSV to really kind of rear its head in such a manner, especially for pediatric population, the big thing is also because of some of our effective prevention measures, a lot of these children did not get exposed to these viruses during, the height of the pandemic when we were enacting very strong prevention measures. So what was usually routine exposure was not occurring. So we're kind of making up for lost time, so to speak, now that a lot of prevention measures have been relaxed in, say the school and work setting. So this is kind of another thing we have to kind of consider as well. So, but nonetheless, the other reason why this is going to uptick quite a bit is we got the holiday blitz coming up. Less than a week, we got or close to a week. We have Halloween coming up, which is a big social event. Then we have Veterans Day. Then we have, obviously Thanksgiving, and then that folds into the December holidays too. And just a lot of travel in general for those 2 months, and then even New Year's. And so just keep in mind, some of those precautions that an individual could take, in preparation for attending these events and activities, just to help mitigate that risk of, unnecessary exposure to respiratory illness, as we're kind of well aware of, get hand hygiene, respiratory etiquette, things of that nature. So just want to hit that point home. So that is kind of the overview relative to respiratory illness. I know there's a lot to it. So monkeypox, I'll go over this very quickly because a lot of this has stabilized, which is really great. So we have about 28,004 total confirmed monkeypox cases for the United States thus far relative to this current situation. And you can see how California is the largest majority of that at 5,372, followed by New York at 4,071. And then if we scroll all the way down here, we get to Connecticut. Connecticut is at 139. So if we flip over here, keep in mind, this is updated by the State Health Department once a week on Tuesday, so it's not going to fully line up, but it's at 138. But if you look at it on a week over week basis, you can see how we had a peak back in August with the 17, but we've never gone back to that point, which is really great to see. And you can see how it's a very clear downtrend as of late relative to monkeypox cases presenting. So I have to say it's really great news in the midst of kind of obviously my dire respiratory illness report. But in terms of county, just to get a breakdown here, Fairfield County is at 46. Monkeypox cases, New Haven County at 38, Hartford County at 33. Age group wise, you see kind of what we were talking about before, the 20 to 49-year-old age groups being the largest majority or proportion of that, but also 50 plus. But that's been holding steady, fortunately, at that 13. Obviously the most apparent and obvious demographic impacted is males, pretty much the whole proportion of that. And in terms of race and ethnicity, non-Hispanic white is a large proportion at 51, followed by Hispanic 41, non-Hispanic black at 31. But then if you factor in, the combination of Hispanic, non-Hispanic black being impacted, obviously that well exceeds non-Hispanic white. So it's still important to kind of consider who's getting impacted. Obviously, it's pretty broad in terms of those racial demographics, but also, when you kind of tally that up, but again, hitting that point home that in terms of gender, this is the most apparent when it's, only 2 female, monkeypox cases have presented in Connecticut thus far. So the other thing, switching gears a little bit more, we're kind of teasing around getting to those freezing points, but we're not quite there. So I still want to warn and caution against West Nile virus activity. So with mosquitoes, because we have 7 human cases thus far. Again, keeping in mind those 2 cases that we had back in, a couple weeks ago or a few weeks ago with Stanford and Greenwich. But then again, the fact that we have such a large proportion of mosquitoes that have tested positive for West Nile virus, and they're all pretty much in southwestern Connecticut where we're at, is just, important reminder just to get through this until we get that solid freeze. Now looking forward to that solid freeze, but because that comes with other things to it, but at the same time, just getting through with the mosquito season too. So that is my overall update. Thank you.
Thank you so much, Brian. Does anybody have any questions about Brian's update?
Always a wealth of information.
Thanks, Ken. Thank you, Brian. Megan is next. She's going to give an update on immunizations.
Good morning, everybody. You can hear me okay?
Yep.
So I'm just really going to review some of our community clinics that we've been hosting. And then hopefully next month, if I make it onto the agenda, I can give you an update on our CAP program and all the work the community health workers have been doing. And so to date, we've held a few types of community clinics. So we held 2 community COVID booster clinics, and we vaccinated 136 people at that clinic. That was, we're used to doing large numbers, but what was interesting about that clinic is it was our first clinics that we've used our own EHR system. So in the past, we were always using VAMS. So this really gave us the opportunity to exercise using our own system, which communicates with the state's immunization registry system. And so all was well with that. So that was a big push for our staff. And then we also held 2 closed clinics at senior living facilities, and we vaccinated 75 people at those sites. And we're also looking to coordinate another high-risk population site in November to vaccinate that population there. And then moving on to flu. So we held 1 community flu clinic at the senior center, and we vaccinated 91 folks there. And then we also have been holding worksite vaccine clinics, and we vaccinated about, 50, where's my numbers? About 56 folks at those worksite clinics. And so we're continuing to do worksite clinics as well as community clinics. Our next large scale community clinic will be November 3rd from 5 to 7 at Brian McMahon High School. And we have registration links on our health department website. We're also vaccinating folks every Tuesday at the health department. And so all those registration links to make your appointments are on our website. And those are in the afternoons on Tuesdays from 1 to 3 by appointment. And then the last thing is I just want to thank all of our staff and our ERT members. Without all of them, we wouldn't be able to host any of these clinics. We have staff that are not usually, in the clinic setting that are assisting with registration and vaccination assistant. And we have volunteers who are assisting vaccinate during all these clinics. That's all I have. If there's any other questions.
Megan, where do we get our information on some of the large employer groups? We work with the chamber and work through them to try to, I think that's such a great public service that if you work in town and your employer is willing to be able to get vaccinated, you'd think that there'd be a good catchment group.
Yeah, so I think in the past we have, I think some of the larger providers moved to other, like CVS's and Walgreens that were able to provide that service to them. But we stay in contact with the ones that we've done historically. So we did the Newark Police Department, the Maritime Aquarium, and Hilltop Homes. And so we're looking to do, other sites also. But it is a big push for us because we are using ERT members. And we're limited on the clinical staff to go to some of those sites. So we really need to make sure it's worth, that we have enough folks
Right.
at those sites that are going to get vaccinated for us to go out.
Yeah, as I was thinking, if you could, connect with a large employer, they could probably tell you how many people would be vaccinated.
Yeah.
Those quick surveys they can do. So,
Yeah.
There's a project for my future. Okay.
Yeah. Join our ERT group and then we'll put you on that.
Thank you, Ken. I'm not going to forget that. I'm writing that down. And thank you, Megan, for that great update. Any other questions? All right. Aniela's next. She's going to give an update about the heat sensor project.
Good afternoon. I am just going to share my screen really quickly, and then we will dive right in. Are you guys able to see my screen?
Yes.
Yes.
All right, great. So I am going to try to fly through this because I know that we've talked about the heat sensor project briefly before, but I am just going to kind of give a brief overview of where we are. So we know that climate change affects NOROC at the local level, and then that it can pose a variety of different threats, especially a number of health threats. And that is largely tied to, some of the different kinds of impacts that climate is having on our health. So let me just, yes, all right. So in 2020, the Yale Center on Climate Change and Health reported on 19 indicators that include trends in health, such as hospitalizations and environmental and climate trends. These indicators fall into 4 different buckets. They're air quality, infectious disease, extreme events, and temperature. And obviously the heat sensor project is focusing on the temperature bucket. So the temperature bucket includes 5 separate indicators, and those indicators are taking a look at average annual temperatures. So, looking at the rise in annual temperatures. All of the counties in Connecticut have experienced a rise in temperature between 3 and 3.5 degrees Fahrenheit since the early 20th century. And we also look at the number of extreme heat days. And while we have not actually had any rise in the number of extreme heat days in Fairfield County, it is something that we can expect based on the patterns that we're seeing throughout the rest of Connecticut and the rest of the country. Frost days is another indicator that we take a look at. And so that's basically the days with a minimum temperature below 32 degrees Fahrenheit. We have not seen a difference in the number of frost days in Fairfield County, but again, it's something that we will probably anticipate in the coming years as the temperature continues to rise. Heat-related illness. So this can, cover or kind of runs the gamut of different things, running from heat stress, or like heat stroke, heat exhaustion, all the way to, death, which is caused by our vital organs shutting down when we are not able to properly cool ourselves anymore because the heat is just too much for our bodies to handle. And then the last indicator is heat stress. And so that's for taking a look at our population and thinking about who might be affected by heat. And so that's thinking about people who are experiencing homelessness, people who are ages 65 and older, people with any sort of immunocompromisation that would make them particularly susceptible to heat. And then people who are outdoor laborers. So folks, working as contractors in construction and in farm labor. So the Yale Center for Climate Change and Health delineated these 7 steps as a trajectory for resilience action. And the first step is to monitor current conditions and project trends, which was the point of this heat sensor project. So we collaborated with the Connecticut Institute for Resilience and Climate Adaptation, CIRCA, at the University of Connecticut. And what we wanted to do was to map and identify areas vulnerable to extreme climate conditions, and to think about the contribution of heat to that vulnerability. And so Circa is using the data to model the differences between satellite temperatures and ground level temperatures, so that we can understand what people are feeling on the ground and what they are actually experiencing. So there are three different primary data points that we were looking to gather. Those were temperature, relative humidity, and dew point. And while we are all pretty familiar with the concepts of temperature and relative humidity, I just wanted to take a second to talk about dew point. So the dew point is basically the temperature that the air needs to be cooled to at a constant pressure to achieve a relative humidity of 100%. With a relative humidity of 100%, that means that the air is completely saturated and precipitation needs to come out in some form. So whether that's in a gas form or rain or snow, that's when the air is so heavy and muggy that it just needs to come out. And so that's what we really feel when we are going outside and saying that it's muggy. It's not exactly the humidity, though, that plays into it. It's the dew point. So based on the data that we collect, we can take a look at tools like this heat index to understand like what kind of heat Norwalkers are actually experiencing at the ground level. So we can gauge the threat taking a look at these tools and see, whether there's a risk of discomfort or whether there's a risk to health. And keep in mind that these heat index values were devised for shady light wind conditions. So exposure to full sun can actually increase these values by up to 15 degrees. So what does that mean? Sometimes a temperature we wouldn't consider hot or extreme might be combined with a high rate of relative humidity, which would place people at a higher risk of heat-related illness. For example, an 85-degree day, Fahrenheit, could put a person at risk of sunstroke with only 65% humidity. We can adapt tools like the heat index using the heat sensor data to understand Norwalk's specific risks at the ground level to create change in our community where our community lives, works, and plays. So taking a look just at the methodology and how we actually implemented this project, Circa and the City of Norwalk's Planning and Zoning Department initially began to discuss the potential for this project in late 2021. By 2022, the Health Department had sort of pulled together an interdepartmental team to work with Circa to identify potential sensor locations. Just want to give a shout out to Brian Weeks at this point, because he was a tremendous help in mapping a lot of those locations and helping us to figure out where the best locations would be. The team acquired all necessary permissions and permits by April 9th, or by the end of April, and sensors were deployed on June 9th. Data is continuing to roll in and deinstallation is planned for November 1st. So quickly, I just want to go over the locations, which were selected based on a variety of factors. The team considered the natural and built design of each site, as well as the population impacted in the immediate area. As you can see, we relied on local zone classifications, which were provided by UConn, which take into consideration the density and height of man-made structures and natural aspects, such as types of vegetation and nearness to water. The purpose was to select several different location types so that we can get feels-like data for a range of Norwalk's ecosystems. We also wanted to ensure that the locations we captured were ones that our population is regularly exposed to, so we chose to include city mainstays like schools, beaches, parks, and municipal buildings. I'd like to take a moment here to thank Circa for all the amazing work they do and for considering our city for this project. Their leadership, funding, and support were paramount to the success of this project, and still are as we are still continuing to collect data. And I'd also like to thank all of the other city departments that were involved in the planning and permissions, as well as Norwalk Public Schools, Veolia Water, and Norwalk Community College, which graciously allowed us to install the temporary sensors on their grounds. As I mentioned previously, efforts began in late 2021, and we will continue until November 1st. But just to take a quick look at what the sample data actually looks like and what kind of information we're getting, I wanted to take a look at July 21st data. So at one point in the day, the satellite temperature, which is what we all kind of see on our iPhones, was reading at 93.79 degrees Fahrenheit. And that's at the Sikorsky Airport. even within the bounds of our city, we saw pretty crazy disparities between our different locations. The lowest temperature that we saw was at Calf Pasture Beach at 96.7 degrees Fahrenheit. Now that's already almost 3 degrees Fahrenheit warmer than the satellite temperature that we were getting. That's nothing compared to our hottest location, which is Booton Street Pump Station, which was at 107.39 degrees Fahrenheit. So we actually have temperatures throughout the city that are reaching over 13 degrees Fahrenheit higher than what's being told to our residents. So how do we use this information? Well, we continue to collect data, which we are doing with the rest of this project through the first. We can strengthen and develop policies. We can develop our action plans, such as the city's POCD. We can exist our programs or enhance our existing programs and resources, or develop new programs that are better suited to address the needs that we have. And we can do a ton of public education, whether that's to the public, whether to city leadership, like, you know, our mayor's office, and in our other community leaders, and common council members and board members like yourself, who really have the opportunity to make an impact. And that's it. So you guys all have my email and my contact information, but I just wanted to put Yaprak Onat's contact information here as well, because she is the assistant director of research at Circa, and she is really sort of the point person for all the technical kind of questions. So if anybody had any specific questions, that is her contact information. So I am going to stop sharing and open it up to any questions that people might have. And if you have no questions, that means I did an excellent job.
Well, you did do an excellent job. Questions or no questions. Thank you, Aniela, really for giving that great update and for all your work on this. And yes, thank you to Brian as well for all of his efforts and pulling this all together for us. All right.
Are we using any of that data for public policy or anything else?
So the data is continuing to come in, and we haven't really had an opportunity to look at the data holistically. When it does, you know, when we have that full complete data set, we will be taking a look at it at the health department. A lot of other departments are also really interested in it, such as the transportation, mobility, and parking department. I know that they're thinking about, you know, where are emissions being produced and where is that heat, you know, affecting people out on the ground. So yes, it will be used, but we do not currently have any projects where we are specifically using that data to inform our work yet.
Thanks.
Aniela, it concludes November 1st, is that correct?
Yes.
Okay. Thank you so much. So I think you're next. We're gonna share some updates about an internship that we've had an intern this fall.
Yes, so just wanted to quickly talk about our new intern, Sam Omari. He is a student from New York Medical College, completing his master's in public health, and for his advanced practicum experience, he wanted to work with the Norwalk Health Department. He is working with two divisions, primarily the Community Health Division and the Environmental Health Division, and is working on two projects. So for the Community Health Division, he is working on a Know Your Numbers program evaluation, which is going to work with clinicians who are providing screenings to their patients to evaluate the program and its effectiveness from the provider perspective. And then in the Environmental Health Division, he is going to be working on a brochure that educates the public, you know, mostly residents, about rodenticide and the harms that are associated with it, and also the benefits that rodenticide can provide to the community members. That's Sam's work in a nutshell. He is going to be with us until the first week of December, if all goes well, and we look forward to the coming weeks with him.
Thank you so much, Aniela. And I really want to thank her for working with the staff to set up a new process for getting applications and interest from students who are looking for public health, you know, practicum experience. So it's been really great to have that formal process set up. And thank you, Aniela. All right, so I think our last item on the agenda is public participation. If anyone from the public would like to speak, will you please virtually raise your hand? All right, I see that we do have a member from the public. Megan, can you promote them so they can speak?
Yep, give me 1 second. My screen froze.
Okay.
All right. You've been able to unmute yourself now.
Ms. Laura Chella, good morning.
Yes, good morning. As usual, I was very interested in all the reports and the work being done related to so many important health issues of the day. I just have two quick thoughts. The first one is, first of all, I wanted to really thank the department and the volunteers, because I went to the senior center last week and received my flu shot. And I know several of the volunteers from the emergency response. So it was a really seamless, very seamless program. But I did go to it with an eye for opportunity for education about infectious disease and COVID. And at the senior center, I was very happy to see at the end of the process, there was a table and it had many, many different flyers and information about not only COVID, it was in Spanish and English. And so that is terrific. Here is what over the last 3 years, I wanted to suggest, and I will follow it up and I hope it will be accepted. And that is, we have at this moment, you have captive audience, so to speak, and it's an opportunity before the holiday season and the cold weather to have some quick study, photos, pictures, a stand-up poster about some of the preventive measures that I have been talking about for over time, and that is reminding people about how to wear their mask properly, reminding people about wearing a better mask, reminding people and actually teaching people about ventilation as people meet together for the holidays in the colder weather. This is something that the state and the feds and Norwalk are not speaking about enough in layman's terms and in accessible language. And I know in my practice as an environmental professional, sometimes pictures are worth 1,000 words. So the MTA in New York, much to my shock and sadness, for a while during the pandemic, towards the end, in the subway system and the MTA, the trains, they had standalone posters with pictures about just representation of a good way to wear your mask and then not a good way, like with it below the nose. And that kind of poster placed in places where people go, a lot of people, such as starting with the city itself at its clinics, would be a wonderful way. I'm a news hound and an info hound, so I went to the table and picked up some flyers, but I noticed that not most people didn't. And you had really pleasant folks at the table. I chatted with them, but one thing that people would be drawn to is a large stand-up, standalone poster with some specific prompts that people, even if they're not looking for it, they can't miss it, would be very helpful. And that is focusing on how to wear the mask, what type of mask, and ventilation, because those things do count in reducing transmissivity, not only of COVID and these variants, but also the flu. And so I think we are missing just free opportunities with captive audience to kind of like psychologically get. And beyond that, I did go also get my COVID shot this Saturday, and there was no line. I'm happy, and I wish the city council, as Agnella said for the heat sensor, I wish the city council Common Council, and the Board of Ed. I wish those folks who are well-known would help you in having special days where they're going to be there, or special and promote this. But there was really almost no one there on Saturday. I know in the past there have been, but again, there were no posters anywhere in sight when I was waiting for my vaccine, my COVID vaccine. I got, of course, the variant one. That would help me, help a layman just kind of like reinvest in what is the right way to wear a mask. Thinking about ventilation. I know that you have a lot of this stuff on the CDC in our website, but it takes several clicks and most people won't go there. I mean, again, people have to be responsible for themselves, but it is the city's responsibility, with all the money we receive, to try to also find creative ways to educate people. Lastly, I really think it would be great, and I think they'd accept this, to have these smaller version of posters at the entranceway to Stop and Shop, ShopRite, and other places, the library, places where people congregate, and give them kind of like a subtle hint about the prevention issues that are so important as people are going to be coming in indoors. I know I've read a lot of officials saying, not from Norwalk necessarily, but like the governor and others saying, oh, people know what to do. Well, they forget. And I think it's our duty to help them because they're laymen. We don't expect them to be an epidemiologist. Yet I think what we can do is put our heads together and come up with more creative ways. And I do know at the last month, and I'll close here, I was happy that there are some games that people could play, but that is, I want to see the creativity in how to do outreach for laymen about mask wearing, the type of mask, and ventilation. And I just don't see it. And I'm a professional. I'm looking for this around, and I see great opportunities where we can come together. And I'd love to see the health department accept a little more about my ideas. It's been very sad and frustrating, quite frankly. And I know you have a lot of enthusiasm. I see it and I hear it today in the reports of all your wonderful staff. But let's come together on this. Otherwise, we're going to see a huge spike this winter and a lot of people will miss work. It affects our economy. I know you guys don't want people to become ill. So let's put our heads together and find fun ways to have pictures to help people. And I hope, Deanna, that you will accept a meeting with me so we can nail this down. There's some really great creative ways with art and pictures. I think it would be very helpful, and I'm sure your staff would like it. Thank you.
Thank you, Ms. Loricella, for taking the time to attend the meeting today and to provide your feedback. Is there anybody else from the public that would like to speak? All right, if not, it is 8:55 and we can adjourn. I hope everyone has a great day.